The world of physical therapy and sports rehab has been changed forever. Learn the ultra-rare secrets of using suspension bands and ropes that are taking the sports world by storm, and how your doctor, patient, friend, coworker will soon be asking you, what do you know about red cord? Now, for years, the most common ailment to the most difficult diagnosis would be all evaluated by a physician, confirmed by an MRI or an X-ray, and treated by a physical therapist. This was just a cyclical law of an injury from sports megastar to your average Jane. As time went on, some elements of this process would change. The big bad wolf, also known as the insurance companies, would not authorize certain benefits if they deemed it was not medically necessary. So they would huff and puff and say, no diagnostic testing, or they would say, no physical therapy. Now this made all the healthcare professionals pretty angry. From physicians to physical therapists, there would be a cry among them, we just want to help people. I hate all of this red tape. But the big bad wolf didn't care. He would scream, read the fine print. So for the last couple of years, physical therapists had to figure out ways to get their patients not only better faster, but more effective as well. It was just unacceptable to get someone halfway better. That same injury would return even greater than the first time. This dilemma perplexed many, and you, the patient, suffered in pain. But here in New York City, a team of heroes emerged. Manhattan Physical Therapy realized that they had to beat the big bad wolf at his own game. Armed with a secret weapon known as the red cord treatment method, they were able to start getting their patients better, faster, and 10 times more effective. This was amazing. The general public was curious. Who was this team of superheroes, and what was this amazing piece of equipment that gave the people the cure to all their injuries and pains? It all started a long time ago in a land not that far away. The red cord treatment program was developed over 20 years ago. In 1991, by a Norwegian carpenter, with the use of ropes and suspension cords, a team of physiotherapists studied and perfected a way of addressing the pain that people face in their day-to-day lives. They coined the term NORAC, which is a combination of two words, neuromuscular activation. NORAC basically challenges the way your brain and muscles react to pain. A great example of NORAC would be when your body is in pain, the smaller muscles of that joint or region would shut down and the larger muscles would take over to help keep you moving. NORAC is a proven system that helps those smaller stabilizing muscles to reactivate, which in turn shut off the pain and help you improve your function. They also studied the human anatomy a bit differently than traditional Western medicine, looking at the human body as a whole unit from your toes to your head. They discovered a fascial connection, which means if you have a problem in your neck, they would start looking and treating your legs and your feet. The results were extraordinary. But don't take my word for it. Let's talk about my patient Danielle. Danielle is a graphic designer who loves to play volleyball, but sits at her computer for about 10 to 12 hours a day. Danielle on one day had pain in her right shoulder. Thinking it was probably due to playing a little bit too much volleyball the night before, Danielle went to a physician who gave her some painkillers and decided to refer her to physical therapy. But Danielle did not go to Manhattan Physical Therapy. She went to the guy down the street. They started her with some treatments by stretching her shoulder, giving her a massage, told her, here are some exercises to do at home. Danielle felt a little better and went back to Mr. Physical Therapist, and, she said, this has been 4 weeks and I'm still having the pain in my shoulder. What do I do? Now, Mr. Physical Therapist was confused. He had used everything he knew on how to fix Danielle. So he did the one thing that he knew he had to do, and that was to refer Danielle back to her doctor. Now, this time the doctor, who said he was so confident that physical therapy would have helped her, now offered her 2 options, more medication or surgery. Danielle felt absolutely helpless. On the way home, she bumped into her friend Molly, who had just left Manhattan Physical Therapy, who was looking and feeling great. She told Danielle there was a team of physical therapists that did things differently, unlike anything she's ever seen, and not to give up. Molly said just after 1 visit, she was feeling so much better that by the 2nd week, they were working out harder at therapy than she's ever done in the gym. Molly told Danielle, you have to see these guys. They're just super. Skeptical, Danielle was so concerned that her insurance wasn't going to be able to cover her treatment anymore because the last physical therapist told her that she was running out of visits. So Danielle called Manhattan Physical Therapy at 1-800-754-0488, and they explained to her about the worry-free guarantee. And what that is if you're not feeling better by your first visit, she doesn't pay. Matter of fact, she gets to come in 1 more time, on us. We want to see you get better no matter what. We will work with your insurance company, and if you don't have any insurance, no problem. We will create a cost-effective program just for you. During Danielle's evaluation with the Red Cord treatment program, she felt like she was in a Mission Impossible movie, being suspended in midair. But she was able to see and feel all of her weaknesses throughout her body, and that her shoulder was not the reason for her problems. With further diagnosis, we've discovered that Danielle suffered from a weak hip muscle, and after one session of fixing her hip, Danielle was simply amazed. Her shoulder pain had disappeared. Who were these superheroes, and how were they able to fix her so fast? Danielle was so rejoiced that she told everyone about how great she felt. She couldn't wait for her second treatment. Manhattan Physical Therapy, with the use of the Red Cord treatment program, were able to provide Danielle and everyone else something that no one else could: a fast, efficient, effective solution. The results were extraordinary. The list of diagnoses that could be treated are endless. But let me give you a few examples. Neck pain, shoulder tendonitis, rotator cuff rehabilitation, impingement syndromes, herniated disc, slipped discs, back pain, ACL rehabilitation, meniscus tears, plantar fasciitis, shin splints, ankle sprains, and much, much more. The benefits of Red Cord relate directly with Manhattan Physical Therapy's mission. We are not just here to rehab you. We want to change the way each person thinks and feels about fitness, nutrition, and wellness. There is never just one solution to our problem. So in conjunction with the Red Cord treatment program, we make sure each and every patient feels that transformation, just like a real superhero. So join our team of superheroes and let's defeat the villains of pain, discomfort, and stress. Let's show the big bad wolf there is nothing to fear with Manhattan Physical Therapy by your side and the use of the Red Cord treatment program. So call today, 1-800-754-0488, and the adventure of the new healthy you has just begun.